accept those reports, put it in the template that we will share again on the mailing list. Okay? We received until now a few, as I mentioned, a few national reports, and I will read the names of the countries, and where there are something special to say or to add or to underline regarding the relationship with national organism or international organism, or something bad or good it's happening or it happened in your country, please mention to everybody now. Or if not, we are going further. First, in alphabetical order, I will read the name of the countries. We received a national report from Austria. If something it's to add, no, thank you. Belgium, no. Croatia, thank you. Finland, France. You have a PowerPoint. Please, Patrick, do it.
No, you can present the PowerPoint. Yeah. You can present the PowerPoint. So we translate a manifesto for an organized health system. It should be probably useful for some other country because it's more or less a mess in France, because we still have direct access for the patient to the secondary and third line of care. Yes, unstructured model of use of care.
You can see
it was the heritage of 1958 law, and we try to say to the government and other that it's important to have a strong primary care team and to prioritize the ambulatory care. We do not invent the wheel, but we remind the work of Barbara Starfield and others to say that its cost effectiveness very interesting. And induce a first-line organized within territorial professional community health center. It was not easy to translate because it's closely linked with our NH, with our, but it should be interesting for some of you. And we try to distinguish clearly the first line, the second and third line. And there is some consequencing regarding the initial training of doctors, including students, because some student doesn't know and never know the first line. They are only in the hospital. Conclusion, we think that 3 clear levels of care will enhance the effectiveness and quality of the French healthcare system. And you can find the report on the website translated in English. And thanks to Mary, we help us to translate it in English. Thanks, Mary.
Thank you, Jean-Pierre. Anything to comment about this? Please, Mary, and Renata after that.
I was very interested in this manifesto for 2 reasons. First, because your territorial numbers, the population, mirrors what we in the UK are thinking of with primary care networks, that we're also talking of populations between 30 and 50,000 people. The other interesting thing was that your advocacy of small local hospitals. We used to have that in the UK, and now we've got rid of them, and I think in rural areas we regret it.
Renata?
Thank you so much, and I would like very, very much to know more about your work because I think we face the same problem with the difference that we have a gatekeeping system. At the same time, we would like somehow to consolidate primary care practices in centers or networks or groups because of the attraction of young people, because of implementing extra services by non-doctors, and we are struggling. What would be the best model, a model of financing and model of functioning? So there we have a lot of questions. Hope we get some answers as well. Thank you.
Thank you, Renata. Other comments? Thank you, Jean-Pierre, thank you, Patrick, for this. I will follow the list. Ireland, you have something to add to your report or to emphasize something?
I'm perfectly happy. I can take the report as read. I'm perfectly happy to answer any questions arising.
If there are not comments, everybody can read it on, it's already put it on website now? Okay. Some of them are there, some of them will be there soon, in a few minutes, hours. Italy, if there are something to emphasize, to add, or to say about your report. If not, Carlo.
Yes, I would underline a question in Italy that is the lack of doctors in Italy. In the next 5 years, 15,000 family doctors will be retiring. And the problem is get worsening because in 2028, more than 30,000 family doctors will be missing because retirement. So we have a problem that, and the problem we are facing with the adding new doctors, new young doctors. And fortunately, luckily, our Prime Minister, our Health Minister of Health has added another 1,000 young doctors for in GPs. So we now are 2,000 new doctors in next 3 years. Thank you.
Thank you for this. We know this is a problem across Europe and in my country as well. I think soon we'll be working with retired physicians until with that. Next, Norway. Yes, Steve.
Our government has ordered an extensive report on our GP system, and it's due in September this year. And the next 6 months, they will make a plan for changing or refinancing our system. So we'll come back with details. It's very exciting.
Thank you. Please use for the future the template. Serbia, okay, thank you. Slovakia? No. Spain?
Sí, presidente, un minuto solamente para comunicar que en el año 2018 creo que es un récord histórico. Hemos tenido 3 ministros de Sanidad diferentes y que en las recientes elecciones convocadas en España pues no se descarta que haya un 4º ministro si es que no se renueva el tercero que había. Decir que llevamos un año con una propuesta de declaración en la Asociación Médica Mundial sobre pseudoterapias y pseudociencias en el campo de la salud. Ha sido aprobada en la última reunión en Chile por parte del Consejo de la Asociación Médica Mundial dicha propuesta de declaración y que va pues a la siguiente reunión de Asamblea General en noviembre, me parece que es en Georgia, y esperamos que sea una declaración firme. Les mantendremos al corriente. El Consejo General de España hace 2 años que tiene un observatorio contra las pseudociencias, las pseudoterapias, el intrusismo y las setas sanitarias, que está dando muy buenos resultados, no solamente en la lucha contra las prácticas y corrientes pseudocientíficas o carentes de la más mínima evidencia científica, sino también contra los movimientos antivacunas que están tan de moda y que tanto daño están produciendo. No hay más que ver las cifras del sarampión en Europa y en Estados Unidos para ver la importancia de combatir estas prácticas. En enero de este mismo año, y aprovechando el mismo tema, hemos firmado con la Orden Médica de Portugal la Declaración de Madrid contra las pseudoterapias y las pseudociencias, con los máximos representantes de la Orden. Como ven, tenemos una relación con los hermanos portugueses muy consolidada y desde hace muchos años. Creo que hay que formar una orden ibérica de médicos o algo así parecido. Y consecuencia de todas estas actuaciones y estos movimientos, el Ministerio de Educación y Ciencia de España y el Ministerio de Sanidad último pues han sacado un plan para la protección de la salud frente a las pseudoterapias, en los cuales la organización médica va a participar. También se ha aprobado en la Asociación Médica Mundial celebrar la asamblea del año 2020 en la ciudad de Córdoba, en España, la Asamblea General de la Asociación Médica Mundial, coincidiendo con el centenario de la creación de nuestro Consejo General de Colegios Oficiales de Médicos de España, que cumple 100 años en el año 2020 y esperamos invitarles. Y nada más, muchas gracias.
Thank you for this. Switzerland and UK, if you have something to add. Thank you very much for your contribution regarding these national reports. And now